Hello, I'm Dr. Michael Peticaro from Rochester, New York, where I'm a specialist in respiratory infections. Testing is important because we're trying to triage cases.
It's very important to understand who is ill and who is not. If we don't have access to proper testing, the truth is we don't know how to properly treat, diagnose, or screen the patients that we're dealing with at the front line. It creates a lot of anxiety, concern, and uncertainty about where things are going and how we're going to be able to treat them to make them get better.
There are three types of tests: the PCR test, the antigen test, and the blood test or serology test. The PCR test, that's where you take a nasal swab deep into the nose or the throat, and then you process looking for a molecular evidence. PCR test is best before you even have symptoms. You can detect the virus with PCR, and it's still there and easily detectable in the first week to 10 days of the illness. That's test number one. Antigen test, also nose swab or throat. There you're looking for the coding of the virus as being detected by a laboratory test. By 2 weeks into the illness, the PCR test is going down. The antigen test is really not reliable until you start to have symptoms. And by the third or fourth or fifth day, as the symptoms are going up, that's when the antigen test really works best. And the third test, serology test or blood test, this is looking for immunity to the virus. It takes about 10 days for your body to make the first response of immunity that we can detect in your blood, and that's called the IgM test. And then about 2 weeks or 3 weeks later, we can detect it even better with another serology test called IgG. IgM is the first antibody response. We normally can detect that somewhere between 10 and 14 days after the onset of an infection. So the next window of time we look at is maybe around day 21 to day 30. Now the IgG is much higher than the IgM. At that point, you probably won't detect any IgM, but you'll see a sky-high IgG level that tells you, okay, the maximum immunity response has now been measured.
Generally, when you build up an antibody resistance, it means that you are protected from getting the worst case scenario of that illness again.
For the PCR test, doctors cannot do that in their office. It has to go to a hospital or to a laboratory. Whereas the antigen test and the serology test, those tests may be possible in a doctor's office or in an emergency room or urgent care setting. However, be careful. As these tests become available, you want to have something that is FDA approved or has been approved under an Emergency Authorization Act or some type of a waiver.
The most important thing for us is accurate, reliable, and factual data.
We're anxious too, but we're doing our job.
If we didn't have nurses and doctors on the front line, if they were too scared to go to work, this crisis would be 100 times worse.
We want to know if we've contracted the virus so that we can then avoid giving care and being contagious to others. And if we do become immune, we want to know that we're immune and we can return to work and we will be able to provide care over the long term.
Today's times are unlike anything I've ever seen in healthcare in my tenure, and I am concerned that until we accurately diagnose and test the significant number of cases that we're seeing in the United States today, we're going to have a significant struggle to be able to support those who are currently on the front lines.
For right now, what we want to do is make sure that our essential providers, healthcare workers, firemen, policemen, those first responders, that we're giving them the support and access to testing that they need for themselves in order to provide protection to the public. We also will be giving that information to our local hospital epidemiologists so we can track this pandemic across the United States.